This video will focus on ethical decision making. For this purpose, I have chosen an ethical dilemma case study, a patient suicide attempt. The case study is about a nurse and a patient, Mr. Green, who confides in her. Mr. Green has end-stage aggressive prostate cancer and tells the nurse he plans to commit suicide, but wants her to keep it a secret. The ethical dilemma which arises here is whether or not the nurse should inform other health professionals about this. The nurse has a responsibility in keeping the patient's anatomy intact, while she also has a duty to report any harmful behavior by the patient to other health practitioners. In this case, Mr. Green, his family, and the nursing staff will be affected by the nurse's decision. To solve any ethical dilemma, it is important to first familiarize ourselves with the term ethics. According to Velasquez and team, ethics is based on well-founded standards of right and wrong that prescribe what humans ought to do, usually in terms of rights, obligations, benefits to society, fairness, or specific virtue. A simpler definition of ethics is a branch of philosophy that deals with distinctions between right and wrong with the moral consequences of human actions. Many of you may have met a nurse once or more than once in your life and would probably come across them in the future as well. Since this case study involves a nurse, let us define what a nurse really is. According to the definition, a nurse is a licensed healthcare professional who practices independently or is supervised by a physician, surgeon, or dentist, and who is skilled in promoting and maintaining health. Like any other professional, nurses too have to face issues which are ethically questionable. According to a study conducted in 2010, nurses face these 5 frequently occurring ethical issues: protecting patients' rights, autonomy and informed consent to treatment, staffing patterns, advanced care planning, and surrogate decision-making. Like any other profession, nurses also have a guideline for ethical practice. These guidelines are called the Code of Ethics. Code of Ethics are a set of principles designed to assist members in sound professional judgment while upholding ethical ideas and obligations. Previously, Australian nurses had to follow the Code of Ethics for Nurses in Australia, which was developed in 2008. From March 2018, the Nursing and Midwifery Board of Australia, NMBA, decided that all nurses and nursing students will have to follow the International Council of Nurses ICN Code of Ethics for Nurses. The NMBA stated that ICN's Code of Ethics were more globally recognized and contextually relevant to all nurses in Australia. To solve any ethical dilemma, it is crucial to point out the ethical principles which are a foundation for decision-making. Ethical principles provide a generalized framework within which particular ethical dilemmas may be analyzed. Justice, autonomy, beneficence, non-maleficence, veracity, and fidelity are ethical principles. In our case study, the ethical principles which can be applied are autonomy. It requires respect for persons' right to make their own decisions about their healthcare. If the nurse informs other health practitioners about Mr. Green's suicidal thoughts, she will be violating his right to privacy and confidentiality and working against his consent. Beneficence. It refers to the ethical obligation to act for the benefit of others. The nurse will have to inform other staff members about Mr. Green's suicide plan in order to stop him from making a choice that is harmful for him and his health. Non-maleficence. It imposes an obligation not to intentionally inflict harm or a risk of harm on others. In this case, the nurse will have to make sure that the patient is not intentionally harming himself and do everything within the ethical guidelines to save and protect him. While we may make a decision based on ethical principles, in order to make the best possible decision, we can use ethical theories alongside the principles of ethics. Ethical theories can be thought of as models for making good decisions about difficult issues. These are classified in 4 types: consequentialism, deontological ethics, natural law, and virtue ethics. To get a better understanding of the theories, I will define each of them. Consequentialism is an ethical theory that judges whether or not something is right by what its consequences are. For example, lying to save an innocent person's life. Deontological ethics is an approach to ethics that focuses on the rightness or wrongness of actions. For example, not lying to save an innocent person's life. Natural law is a belief that certain laws of morality are inherent by human nature, reason, or religious belief, and that they are ethically binding on humanity. For example, it is universally accepted that killing someone is wrong. However, punishing someone for a murder is right. Virtue ethics is an approach to ethics that emphasizes an individual's character as the key element of ethical thinking rather than rules about the acts themselves or their consequences. The theory relevant for this case study is utilitarianism. Utilitarianism is a branch of consequentialism, and it proposes that one should act in a way which produces the greatest happiness of the greatest number. In this case, the nurse will have to make a decision which will not only benefit Mr. Green, but his family and the whole nursing staff as well. Following are some recommendations for actions that the nurse must follow. To ensure that her decision is ethical and lawful, the nurse must go through the ICN Code of Ethics for Nurses. The nurse must review any ethical principles which can be applied to her situation, and the nurse should use any relevant ethical theory to make the best possible decision. What decision should the nurse make in this situation? Well, according to the ethical principles of autonomy, beneficence, and non-maleficence, the theory of utilitarianism, and the Code of Ethics for Nurses, it would be ethical and acceptable for the nurse to inform other health professionals about Mr. Green's suicidal thoughts so that appropriate action is taken at the proper time. This will not only save Mr. Green's life, but save his family from unnecessary pain and trauma, and the nursing staff from emotional distress. Thank you for watching. I hope you enjoyed the video.